When a sports injury occurs, athletes are in need of specialized care to get back to training and performing at their best. St. Luke's Orthopedic Care has a team of experts in the sports medicine department who are ready to treat and care for athletes of all levels. Today, we'll learn more about sport-related injuries and treatments available at St. Luke's. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at orthopedic sports medicine offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Our first panelist tonight is Dr. Alexander Johnson, an orthopedic sports medicine surgeon who provides orthopedic care for athletes and active individuals of all ages. He's particularly interested in treating issues such as labral, rotator cuff, and meniscus tears, as well as ACL injuries and shoulder instability. Dr. Johnson, thanks for being here.
Thanks for having me.
Tell me a little bit about what it takes to become an orthopedic sports medicine doc, as well as why you're interested in this field in the first place.
I originally got interested in this because I was an athlete. I had a lot of athletic injuries. I played sports through college. Football was my main thing in college. And along the way, I was becoming more and more interested in that. And those are the doctors I saw. I trusted them. They helped me keep playing. So that's what I wanted to do. As far as becoming a sports medicine specialist, I had to do undergraduate college training, I had to do medical school, and then there's residency, and then I did a specialized fellowship in the University of Colorado where working with a lot of high-level athletes, doing a lot of high-level sports medicine type surgeries to help hone those skills and become more specialized in that field.
Yeah, and reading your introduction, I read a lot of things that I hear commonly with either friends who used to be athletes or people who have children who are athletes who are working on an ACL, a meniscus. So how common are these injuries and how easy are they to treat?
They are relatively common, particularly in active people who are playing sports. So a lot of them are adolescent patients or young adults who are very, very active. So it is a common injury in those patient populations. As far as ease to treat, it's something that we do a lot of. It's very complex sometimes, but it's something that I like to do quite a bit. And when it's successful, it's one of my favorite things in the world to do. So I don't know if I would say it's necessarily easy to treat, but it's something we do a lot of and can do it very well.
And get people back to their active lifestyle.
Exactly.
Thanks for being here.
Yeah.
Joining our panel next is Dr. Michael Hendel. As an orthopedic sports medicine surgeon, his expertise includes the treatment of minimally invasive surgeries, as well as the reconstructive treatment of shoulder, elbow, hip, knee, and ankle injuries. His deep understanding of the challenges his patients face make him a great advocate for athletes and active individuals. Dr. Hendel, thanks for being here.
Thanks for having me.
Tell me a little bit about how an orthopedic sports medicine surgeon is different from a general orthopedic surgeon, and what makes that specialty so intricate.
So I'm one of the sports medicine and shoulder surgeons here. I primarily treat injuries of the shoulder, hip, knee, and ankle. And it started off obviously with undergraduate, just getting a major in biology at Bethel University in Minnesota. From there I went on to graduate school and got a PhD in cardiac physiology at the University of Minnesota, which kind of drew me to the Cleveland Clinic where I did my medical training. And that was a 5-year program with an integrated research year. And there I kind of first learned that I liked orthopedics and was drawn to sports. I also was sidelined from an injury and was drawn to sports from that perspective. And that's what drew me into orthopedics in the first place. And I eventually, did my training out at Hospital for Special Surgery, which is in a very specialized orthopedic hospital, one of the largest in the world. Stayed on for 5 years for general orthopedic training, and then we decided to, continue that on for an additional year of fellowship in sports medicine training. Had the opportunity of working with athletes of all levels, high school all the way through the professional level, and even served as team assistant physician for the NFL New York Giants. As a fellowship trained sports surgeon, you typically see athletes of all injuries. That doesn't mean they have to be an athlete, but it's just an additional year of training, primarily in kind of minimally invasive type of surgical techniques that we use, arthroscopy to, treat these types of athletic injuries. So in addition to treating athletes, in the office and in the operating room, we also have an opportunity to work with professional sports teams, all the way from high school to professional level. And it's really a great experience and hoping to get athletes back to their level of play they enjoy.
Excellent. Looking forward to learning more from both of you. Thank you for sharing your expertise. We'll be right back after a short break, but before we do that, let's check in with Matthew Johnson out in the field as he discusses physical therapy modalities.
Our office specializes in treating athletes. We treat a wide range of athletes from young to old. We have someone who specializes in treating dancers. Hi, my name is Matt Johnson. I am the facility director of our Sports Medicine Rehab Center. To attend physical therapy, there's no prescription required. Anybody could call up the office and request to see a physical therapist. Modalities that we'll use. We do a lot of video motion analysis. We'll look at runner's gait, someone swinging a golf club, pitchers and their form with that. You have a chronic tendon injury, that tendon kind of thickens a little bit. You have blood vessels grow in, nerves grow in, that's why it becomes painful. Shockwave can kind of decrease that thickening of the tendon, which then leads to less pain and improved function. Laser is something that works really well for acute injuries to kind of decrease inflammation, which is just stimulating certain cellular activity to accelerate the healing process. Blood flow restriction has been a game changer for atrophy. It's a cuff that goes above the injured area. That decreases how much blood flow goes to that muscle. It kind of tricks the muscle into thinking it's working much harder. When there's a significant injury such as an ACL tear, the cognitive mapping of the brain changes a little bit. So neurocognitive training, we're actually trying to restore that normal pathway. We use blaze pods in the clinic. There's a visual stimulus that the patient has to respond to and perform a physical activity, and it helps restore those pathways. It's hard to go into the next step of all right, walking feels great, now I want to run. How do I bridge that gap? So we use anti-gravity treadmills at St. Luke's, so we can get your body weight down to 20% and then gradually increase it as time goes on, you improve. And that way we can return to running a little bit safer. Dry needling is a very thin needle that's inserted into the problem area, muscle tendon, so that can get that muscle to relax a little bit more, decreasing pain. We have a system in place called the return to play criteria. And what it is a series of tests that determine when an athlete is ready to go on to sport-specific training. It's kind of a two-phase process. At each phase, they have to pass some physical tests. The combination of all the different technologies and modalities that we have and the skill of our staff is really what allows us to take everybody to the next level. St. Luke's is the largest sports medicine provider in the region. Our physical therapists have specialty training in treating athletes. With that expertise, you're getting high quality care, you get back to playing your sport a little bit quicker, and you're safer in doing so.
You're determined to stay active and enjoy life. Be at your best every day with St. Luke's Orthopedic Care. Start here and we'll get you back to doing what you love. With locations throughout the region, including our new St. Luke's Orthopedic Hospital West End campus, the best place for orthopedic care is always close to home. St. Luke's Orthopedic Care. Start here, go farther.
I would recommend the St. Luke's School of Nursing to anyone that was pursuing their degree in nursing.
When students come to St. Luke's School of Nursing, you can expect a holistic approach.
Making a program that is dynamic and diverse and evolves with time is very important to us.
We not only see the moment, but we also prepare you for the future.
When I hire the School of Nursing graduates, I know I'm getting a quality nurse.
They're here to teach you everything you need to know to care for these patients effectively.
Welcome back to St. Luke's Health Now. Tonight we're discussing orthopedic sports medicine and the many advances offered at St. Luke's. We want to thank you for tuning in and for submitting questions that we'll get to later in the show. Joining me are experts in the field, Dr. Alexandra Johnson and Dr. Michael Hendel. Let's dive deeper into orthopedic sports medicine at St. Luke's. Dr. Johnson, I'm going to start with you. What are some of the most common sports-related injuries you see, and do most require surgery?
I'll start with the question about the surgery first. I would say that the vast majority of injuries we see don't necessarily require surgery. There's a lot of good opportunities and techniques we can use to get people back to playing without surgery, including bracing or physical therapy and returning them back to what they want to do after some time off. As far as things that I see most commonly in young active athletes, ACL tears, meniscus tears, injuries to the shoulder, including shoulder dislocations, I would say those are among the most common things that I see. That may be a little bit different if you look at older patients who are maybe manual laborers or working hard in other ways, where it's more likely they're going to see things like rotator cuff tears, maybe some early arthritis, and sometimes those require surgery and sometimes they don't. And we have really good new techniques for both that help them get back to doing what they want to do.
Dr. Hendel, Dr. Johnson is mentioning athletes for something that's just repetitive motion. Maybe you do it in your job over and over again. Tell me a little bit about the different types of injuries you see. Maybe it's a trauma or a fall, or maybe it's repetitive use, and how do you differentiate those two?
Yeah, most often when you think about a sporting injury, it is a traumatic injury. Like, for example, you'll hear about the athlete that had like a non-contact pivoting injury where they tore their ACL, or a traumatic, fracture. So that's the most classic kind of form when you think of an athletic injury. But I think often unrecognized is the overuse injuries. What this typically is this is just from overusing your soft tissues or bones, and it ends up getting a micro trauma level of a sport injury. And these often can be treated non-operatively without surgery. Sometimes surgery is an option, but most often these can be treated with conservative treatments, such as we use the acronym RICE, like rest, ice, compression, and elevation. But I think it's underrepresented with these overuse injuries, but very, very common in athletes.
Rice, I hadn't heard that before. All right, rest, ice, compression, elevation. All right, very good to know. Dr. Johnson, you had mentioned getting athletes back to the field, which is really important, but what about sort of just regular people that have an injury getting back to their life? You hear people wanting to play with their grandkids or get back to their job. How important is that to you, and how do you achieve that?
I would say that's something I even do more commonly than these young patients with athletic injuries. Most of the patients I end up seeing are patients just like you described. They want to be active, they want to hang out with their family, they want to do their job and provide for their family. A lot of the times, without any trauma, they don't need a surgery. The things that we can do to help them are increase their level of activity, increase their level of fitness. One way to jumpstart that process is by getting them into physical therapy, so they can see that movement and strengthening of their limbs and extremities helps them feel a lot better, and it can help jumpstart a more active lifestyle. So that's one of the things I like to talk to my patients about the most. Is the more active you are, the more fit you are, the more prepared you are to do things, the more happy and fulfilled they can be in their personal life with their family and doing recreational activities.
Yeah, often an injury can prompt that going to physical therapy and maybe getting fit and having a healthier lifestyle to support your musculoskeletal system as you age. So that's always helpful. Dr. Hendel, we've talked a little bit about different types of procedures that can be done. Can you talk to us more about kind of conservative, non-surgical, and minimally invasive techniques so people aren't afraid to come to the doctor in the first place, because surgery is generally what people are afraid of?
Yeah, again, we always try to exhaust all the conservative options first. And typically, when an athlete comes in with an injury, if it's an overuse injury, most often these can be treated without surgery. And that would involve things, conservative treatments, like obviously physical therapy is a kind of a mainstay of treatment for orthopedic injuries, and this involves strengthening the muscles, getting better range of motion, just giving them better function overall. Sometimes it's necessary to use steroid injections into the joint, or a viscosupplementation, which is like a gel injection to help with underlying conditions like arthritis or just pain and inflammation, and it can help temporarily. Sometimes bracing is necessary if they have instability. But, very often it's just rest. A lot of times athletes are very active. They want to get back to their sport. They need to be shut down. Just allow your body to heal and give it time to heal, because that's the number one thing. It's kind of tough with athletes, but ultimately rest is probably the primary treatment for a lot of these overuse types of injuries. If surgery is an option, that's obviously a discussion. Depending on the complexity of the injury, that's a discussion you have with your surgeon on, what type, depending on the type of injury and what their level of play and how they want to get back to sport. That's a decision the surgeon has with their patient in terms of if that's the best option for them.
Yeah, nobody likes to have to be down and out and kind of rest, and it is the hardest medicine sometimes to take. Dr. Johnson, if someone does require surgery, how soon can they get back to their sport or their active lifestyle, and what role does physical therapy play in that process?
It's variable, okay? So there's a lot of different types of injuries that require different times of recovery. Certain surgeries will do, it could be 4 to 6 weeks, and they're getting back to most of the normal activities. There's other things that take a lot longer. For example, a rotator cuff tear, one of the reasons we try to exhaust non-operative treatment is because it can take 6 months for a full recovery after that surgery. Or after an ACL tear, some athletes, or most athletes, won't get back to playing until 9 or even 12 months after that injury. So that time can be a challenge for a lot of athletes. Along that whole time, though, physical therapy is incredibly important. For a lot of my surgeries that I do, I have people start physical therapy within a few days of surgery, and they're starting to work right away in that recovery process. And that continues throughout the entire time that they're recovering and trying to get back to what they want to do. So it's incredibly important, and the time is just variable depending on the injury.
Sometimes you just have to be patient. Dr. Hendel, can you tell us, what is arthroscopy in sports medicine and when is it used?
Yeah, so arthroscopy is kind of what we discussed a little bit earlier in terms of fellowship training in sports medicine. Is typically when you learn to use arthroscopy, it's a minimally invasive technique where the surgeon typically makes small incisions into the skin, like into the joint, which are usually less than 1 centimeter in length. And with that, they kind of insert instruments such as an arthroscope, which has a camera on it. It has light source from fiber optics, and also has a magnifying lens, basically to look inside the joint and diagnose and treat injuries. So the advantage of this is that having a smaller incision, and a lot of times in sports medicine we do need to revert to the open surgery, which is kind of what we call the old school way, like if it's necessary at that time for the particular injury. But the advantage of using arthroscopy and minimally invasive technique is that the incision is smaller, the collateral damage to the other soft tissues and bones is less, and typically patients end up returning to sport or their level of play a little bit quicker, and just less trauma overall. So it's a very effective technique.
Yeah, and you mentioned that there are different techniques. Dr. Johnson, what have you seen over the years, and how far has orthopedic sports medicine surgical options come? What are some of the innovations?
That's a very good question. There's a lot of new things that have come out in the last couple of years that are becoming more common and help us tailor treatments to specific patients. So, for example, when I'm treating an ACL injury, there's a number of different options for how to reconstruct that ligament. So there's different grafts that will fit one patient versus another patient based on their level of activity, where they are at their stage in life. So there's different things we can tailor to each patient from that standpoint. There's a couple other techniques now. For example, there's some augmentation to add extra stability that I do now for a lot of young patients that have an ACL tear. So not only are you reconstructing the ACL, but there's also some techniques to add additional stability. For example, there's a procedure called the lateral extra-articular tenodesis. So I know that's a mouthful, but that is something that we can utilize some other structures around the knee just to add that extra stability. And it has been shown to decrease the amount of re-tears for people that have an ACL tear and need a surgery for that. So that's something that I think is a phenomenal innovation that I've been using more and more as research continues to support that it's a good idea in a lot of certain patients.
Truly incredible what can be done now to get people back to their sport or active life. Dr. Hendel, St. Luke's is the region's largest provider of sports medicine. Lots of high school athletes are treated. Are young people particularly prone to injuries, and if so, why?
Yeah, absolutely they are. I think they're probably even more prone than adults just because they're more active individuals when you're younger. You're also growing and, just the ligaments and bones and so forth. There's different stresses on them when you're a growing individual. A lot of times younger athletes, when we see them, it is an overuse type of injury where they're just, they're going too hard and they just need to rest the body. I mean, these are classic injuries we see. If it's a shoulder injury, maybe they've are just throwing too much and they're pitching, the pitch count's too high in a baseball game, or they're sometimes racket players can get the injuries to the elbow, like tendonitis down there. Runners can get patellar tendonitis and stress fractures and so forth. So typically the mainstay of treatment for these types of injuries is just kind of giving them appropriate rest and so forth. But yeah, we do see it in youth athletes very often.
It's pretty incredible how many options are out there for patients, but the first step is they've got to call their doctor and get checked out. So thank you so much for both of you for all of that information. We've got some questions that were sent in from our audience. We'll get to those right after this short break. Stay tuned.
I have been dancing since I was around 3 years old. I've always just had such a passion for dance and sharing my story through movement. I think it's a beautiful thing. I dance over or about 30 hours a week, and I overworked my foot and I fell completely out of my turn. Then that following week I had the appointment. We figured out that it was a stress fracture.
It's such an untapped area. We provide higher level care for artists. We have everywhere from down in Quakertown all the way up and through the Poconos. We have providers that are now educated and are passionate about the arts and treating artists. The way that she was presenting, where her pain was actually very, very deep in her foot, I was like, I think there's something going on with your bone. So then that's when I referred her to Dr. Niles, and she did the MRI, and we actually found the injury that she had in her foot.
She had a stress fracture of her fourth metatarsal. By the time I saw her, we had to shut her down for a bit of time in crutches and a walking cam boot, and then gradually return her back into dancing. Then we slowly introduced rehabilitation with our St. Luke's formal physical therapy team that works specifically with the dancers.
I think it's really important to let this community know that there's healthcare providers out there who understand the demands of what they need to do. So we did a ton of balance activity, a ton of strengthening activity. that was very specific so that as she transitioned back into dance-specific things in the studio and at the school, she'd have the control and have the best form possible to prevent another injury like this in the future.
We help work with our local dancers as well as any other athletes in performing art. Come see us with their musculoskeletal injuries. We assess them and just help them get back into play after they have an injury or if they have any chronic pain going on.
It's really cool that we have the specialization within our network of people, again, who understand the load and the demand of this very specific group of athletes.
I felt very supported and cared for. All of the staff really had just such a huge impact on my recovery. Really, without them, I wouldn't have recovered the same that I did.
In Isabel's case, Liz and Dr. Niles and I communicated really effectively. We spent a lot of time sitting down and figuring out what her plan of care was to make sure that she returned more easily to dance.
We were in constant communication about her care. That's something I think that's very unique to our network, is just a constant overlap of all of us working together to provide the best care.
I'll reach out and call Emily, our athletic trainer over at the dance high school, let her know what we have and kind of what she can continue doing with the dancers.
It is so valuable to have a trainer like Emily at a performing arts school. She has everything you would ever need to help your body and even your mental health. She gave me a lot of workouts and she's always been there to help me. She showed me the forms of all the workouts to make sure I was doing those correctly and getting the strength back in my foot that I needed. Without St. Luke's, I wouldn't have had the opportunities and the outlets to do all the workouts and to really get my body back in shape and have that stamina for dance. I'm very excited to get back to doing what I love.
It's ultimately about improving quality of life at the end of the day, and getting back to dance and getting back to performance was what was going to improve her quality of life.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had an engaging conversation about orthopedic sports medicine at St. Luke's University Health Network, thanks to our amazing panelists. Now we have some questions from our audience. You ready? Mm-hmm. All right. Dr. Johnson, I think this one's for you. My daughter plays soccer in a travel league and recently tore her ACL. Does this type of injury always require surgery, and what is the recovery time going to look like for someone who is only 15? I bet you hear this a lot.
I do, and in a 15-year-old who wants to continue to play soccer, I mean, we do take into account what their goals are and what they want to do after recovery from that injury. But a 15-year-old that wants to play soccer, the most reliable way to get them back to doing that is to reconstruct their ACL. There are a few new techniques for repair, which is different than reconstruction, that sometimes is a discussion, but for the most part, an ACL reconstruction is kind of the gold standard for what's going to get her back to playing. So yes, the vast majority of 15-year-olds with an ACL tear, I would recommend surgery for. As far as recovery time, this is one of the most frustrating discussions to have with a patient that wants to be active, because they are going to be out for probably 9 months, sometimes a little bit longer. And although we have a ton of new techniques to help the success rate of surgeries like this, the biology of the human body still requires that time for the new ACL to strengthen to a point where it's safe to return to sports.
9 months is not the same at 15 as it is at 40.
No, it's not. It can feel like a lifetime for them already. So.
But it's important to rehab properly and take the time.
Exactly, yeah. We know that before that 9-month period, the rate of tearing it again is higher. So that's why, although that's a frustrating conversation to have, a lot of time it can take that long.
Yeah, makes sense. All right, Dr. Hendel, for you. We often hear the term sprains and strains and tears when it comes to orthopedic injuries. We do hear those three things. Can you explain what the differences are and what types of injuries heal on their own, which ones might require surgery?
These are both soft tissue injuries. Sprains are typically an injury, a stretching or a tearing of a ligament, whereas a strain is typically a tearing of a muscle or tendon. Most of the time, if they're mild strains and sprains, these can be treated non-operatively with conservative measures, like we had mentioned earlier about RICE, like rest, ice, compression, and elevation. But if it's a more complex injury, often it may require surgery. Again, that's a discussion you have with your surgeon in terms of what's the most optimal treatment at that time for the particular type of injury.
Excellent, good to know. All right, Dr. Johnson, I'll throw this one to you. I am not an athlete, but I have a physical job working in a warehouse. I've been putting off treatment for rotator cuff tear. Does this condition usually require surgery, and should I see a sports medicine surgeon to have it evaluated? Yeah, what does this person do in that situation?
First of all, anybody that's dependent on their body for work and their livelihood, and they're having pain in a certain joint, I always think it's a good idea to come in and see somebody that specializes in that, such as a sports medicine physician like we are. That being said, people with rotator cuff tears, there's two different types that they fall into. Some are acute and traumatic, and there's a specific injury that leads to a large level of dysfunction. Those a lot of times do require surgery, or at least they do better with surgery. There's another category of rotator cuff tears where it kind of comes on slowly. It's something that they start to notice some progressive pain in their work, and the vast majority of those types of rotator cuff tears may not even need a surgery. But the people that make that decision are people like us that can evaluate and get those nuanced differences between those two types of patients. But most people with a rotator cuff injury are going to end up with physical therapy before going to surgery right away. So there's lots of different options there, but something that I would recommend getting in to see somebody that knows what they're talking about for that.
And certainly at the very least they require rest, which might be tough in that job, so important to seek help. All right, Dr. Hendel, this is for you. My son sustained a shoulder dislocation from playing football. He has since had surgery to repair it. What can he do to protect himself from future injury if he continues to play football? And should he stop playing football altogether? I bet you hear that a lot from the parents.
Actually, a shoulder injury is a very common injury we see in athletes, especially football. Part of it's just due to the inherent instability of the shoulder joint relative to some of the other joints that have a deeper socket. The shoulder is a little more susceptible to injuries like dislocation. And depending on what type of surgery he had, it could be more complex. Typically, the mainstay of getting them back to their sport and getting back to their level of play is physical therapy. And the reason why this is helpful is it really does strengthen up the shoulder joint, all the muscles around the joint, to help kind of strengthen the shoulder girdle to make it more stable and increase functionality, ultimately allowing that athlete to get back and play the level of sport that they want to play and love.
Excellent. All right, Dr. Johnson, this is for you. I recently started running about 3 months ago, and I'm having repeated pain in my left calf. Should I see someone about it?
Yes. Yeah, no, that's a very common scenario. Somebody that maybe wasn't much of a runner and then they get into running. It's very common to get some type of new overuse or pain, different things that could be going on. There are some things that can be kind of serious that should get some specialized attention, but most of those things we can identify and address with either physical therapy, rest, different other modalities that can get them back to doing what they want to do soon. But getting in to see somebody is a good idea, I think, in that situation.
Always, if you have pain, can't hurt to get it checked out. Exactly. All right, Dr. Hendel, this is the last question for you. I'm in my mid-50s and I was an active athlete all of my life. I'm starting to have some pain in my knees. When do I see a doctor about it? This is probably pretty common. I know several people who were former athletes, and it takes 20, 30 years till they start to have pain. What do you do to treat that?
So often when you're thinking about treating these types of injuries, if it's a person in their 50s, it can be a number of different things. It could be an injury, again, like we discussed earlier about like an injury to a ligament or the meniscus. Sometimes they can have some early signs of some degenerative type of stuff like an osteoarthritis type of picture, or and these, again, the treatments vary depending on what the injury is and how they're doing, and it's better to see someone as soon as possible to get that resolved and actually know what you can do to actually prevent it from getting worse in the first place.
Well, it sounds like there are a lot of really excellent solutions for people who are having any kind of pain or any kind of injury with you and the team at St. Luke's. So thank you so much for sharing your knowledge and being here with us. For more information on orthopedic sports medicine and the services offered at St. Luke's, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thanks for tuning into this special episode. We hope tonight's program leaves you feeling informed, inspired, but most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.